Hi, my name is Dr. Melissa Thompson. I am a pelvic floor physical therapist in South Louisiana. I have a practice here. This is where I'm at. I'm in my clinic. I got my doctorate in physical therapy in New Orleans quite a few years ago. And before I became specialized in the pelvic health field, I was working in traditional orthopedics. I ended up having pelvic pain issues of my own, and I decided after trying to find different people to help me that women's health issues are just really hard to get help with. It's hard to find specialists who can do more than just dig on the surface, and I decided to go and specialize further in pelvic floor physical therapy. And then more recently, I have my fertility awareness mentorship certification that I'm almost done with. Often you'll go talk to your doctor about wanting to get pregnant, and they'll just say, don't worry about it, just start trying. But with the fertility awareness training, there's actually a ton of stuff that you can do in your own hands before you ever even try and get pregnant. And we can optimize your cycles and work from a more holistic perspective on menstrual cycle health.
My platform is really all about sex ed and sexual health and being aware of um, all of the parts of that we really aren't taught traditionally in school. And so I like that you've sort of created this holistic way to look at pelvic health and reproductive health and fertility and all of that. One of the questions that I had gotten the most, and part of the reason why we really connected over Instagram, is I was getting a lot of questions about postpartum sex and like how to kind of restore your sex life after you've had a child and what that timeline looks like. And your hormones do like a lot of crazy things after you have children. And so like you can't really expect to have the same sex life you were going to have based on that alone. But then like I feel like most people know that to have sex with a person, to have those like intimate moments, you have to be so like relaxed and your mind has to be in the right place. And if you have an infant, never mind if you have more than one, I would imagine that that alone is like its own bucket of challenges. But I had done a question box, and the two questions that I got about postpartum sex was about not having a sex drive for anywhere from 7 months to a couple of years post pregnancy, and about having sex while pregnant.
Yeah, I love these questions. Postpartum is a very unique time in a woman's life. To do this question good diligence, we have to say that women's health is just highly under talked about. There's so many visits required during the pregnancy for the baby. Very few visits get prioritized for the mother. So when we're talking about pelvic floor therapy perspective, I'm talking about you, the mother, because I'm not a specialist in regards to anything baby.
Right.
It's like when you have the baby, all eyes turn to, let me see the baby, let me hold the baby, how's the baby? And I think that plays a huge role in mothers not feeling prioritized. Like, you don't care about me anymore because you just want to see the baby. ACOG, American College of OB-GYNs, they also do publicly support and recommend at least one visit before 12 weeks with the pelvic PT. So that's what I want to say first, is that we definitely want to get into supporting mothers. If we go back to just general cycle hormones, progesterone goes up and it skyrockets while you're pregnant. And progesterone is one of those hormones that just makes us feel so good, makes your skin glow. It supports the baby, and it's keeping things going. And then estrogen is also like 30 times higher during pregnancy.
30 times? That's crazy.
It is the most estrogen and progesterone that you probably have ever experienced. When we are postpartum, that starts from the moment of delivery. The uterus starts contracting back down, And now everything is, you're basically having a very, very big period.
I never had children, but I feel like one of the things that I hear a lot about after you've had children is you have like a lot of leakage and there's a lot of just like sort of stuff cycling out of your body. And now it's kind of making more sense. I'm assuming that that is like the uterine lining just shedding out. And that's why you're wearing those kind of like diapers and pads and stuff for a little while. That's crazy. It also is sort of connecting with me, like, when you like, your uterus would have had to expand to be so large to hold a child, so the amount of shedding that you would have to do.
And at that time, it's like a rapid just crash down from that high progesterone, high estrogen. That change from the rapid fall feels bananas. Moodiness, PMS, and then definitely vaginally. There's going to be a shift now from being super lubricated all the time from the high estrogen, and now we're going to be suddenly maybe a little drier.
Mm-hmm.
And then if we're breastfeeding, that is even more magnified, because when we're producing milk, the body goes into a mode where it's not trying to ovulate anymore at this point. Prolactin is prioritized in order to produce milk, and that's going to actually suppress estrogen. So it's suppressing your own lubrication on purpose until you kind of wean off breastfeeding and you get your cycles back and everything. So that is a kind of more of the background of what's happening. What we want you to do is to take it easy, take your time, especially if there's an emotional component to it. If there was birth trauma like perineal tearing, or you had an unplanned C-section, a lot of those events can really be a lot to work through, and we don't want to just rush back into sex and have more on top of that if you're not ready. Getting something, moisturizer that you can put on vaginally, is really helpful. And I always recommend super clean products that don't have fragrances or parabens or phthalates or endocrine disruptors. Use lubricants the first time. Definitely, of course, see a pelvic PT, so you can work out any of that vaginal scar tissue, and you can learn strategies and techniques to see that your pelvic floor is functioning really healthy, and kind of decrease that pain before you go into sex. Yeah.
It's actually kind of wild. It's like it's wild to think that that's what our bodies are actually doing. That's
Your uterus, by the end of the third trimester, your uterus is up in your rib cage. Like,
that's so scary.
and that's why if you've ever touched a pregnant mom's belly, it feels firm.
Mm-hmm. Yeah, that makes sense. Oh God. Okay. That's this whole conversation is going to further reinforce that I will be waiting to have children. That's just wild. Well, and one of the other things that even from like a coaching perspective can be helpful just to sort of like do the best you can to create the best context around the sexual experiences that you're having. Hello, your kids might be being babysat with a neighbor or a grandparent or a babysitter, whatever it is, going to like a hotel if that's something that you can feasibly do. Just something to create some of the separation between all of this, like these new and exciting but like emotionally and mentally taxing parts of your life. I mean, people who don't have children have a hard time staying in the moment. So when you actually have children, I can't imagine now being responsible for yourself and your own stress, and then also the stress and emotions of a child too. So someone had also asked, how does the baby feel in your womb when you're having intercourse? I can't imagine that it would feel anything, but I also think that the baby doesn't know what that is or cares.
Yeah, so if anything, the penetration would hit the cervix, and the baby is a lot higher than that. But as long as you've got the A-OK, you're not harming the baby. And there's even some thoughts that way later in the third trimester, it's sex that can be one of those things that stimulates labor.
Right. I've heard that before, that if you're trying to get your water to break and get contractions to start, that sex is a way that you're supposed to be able to do that. I could just picture that if and when I do get pregnant, I'm going to look like a sofa. Like, I just know it. And I can't imagine wanting to have sex in that moment. I'd be like, no one touch me.
Yeah. I think by the end of it, you're feeling just really pregnant. And so you're like,
Yes.
Yeah, I can't do that anymore.
Yeah, exactly. That's really nice of you to suggest. It's gonna be a pass for me. I don't think so. Further down the pregnancy conversation, there are also people asking, like, what are some healthy habits that they can have before getting pregnant, to help in the fertility process? Like you said, a lot of times you go to the doctor and they'll say, like, well, if you haven't been trying for a year, then there's nothing to worry about. So, what are things that people can do sort of proactively if they are trying to get pregnant?
So many things.
Mhm,
And, we have to think about too who we're asking when we ask
mhm,
these questions. If you ask a medical doctor, they're thinking about medication. And
right.
so that's why they're saying that you need to wait a year because they're not going to put you on a fertility drug when we don't really know if you can just get pregnant naturally on your own. In a healthy menstrual cycle with a healthy sperm partner, there is only a 25% chance of natural conception per cycle. You can be doing everything right and can be totally healthy, and you may not still achieve pregnancy the first or the second cycle. So that's where some of
Mhm,
that background of waiting comes from. However, if you're a planner and okay, I'm not ready to get pregnant now, maybe next year, that is perfect timing for you because you can start doing all of the foundational strategies to optimize your health. And that way, when you do move into trying to conceive, you may not have to spend too many of those cycles with negative pregnancy tests, like optimizing your cycle. So, if there's an underlying issue, PCOS, endometriosis, IBS, those things ideally should be taken care of early because the pelvis does not like all of that inflammation. You could be getting a fertilized egg, but it's just not sticking, it's not implanting into the uterus,
right.
not a happy home. This looks like taking inflammatory things out of your diet, having a full, hearty, 400 to 500 calorie balanced breakfast where you prioritize protein and then drink your coffee. Balancing blood sugar is huge, especially for PCOS. We know now more and more research is coming out that insulin resistance is a huge driver of cycle abnormalities and is definitely a contributor of infertility. Definitely get 7 hours of sleep at night in the dark. If our sleep is disrupted, we can't make it good progesterone. And then we want to start taking prenatals early on. We want to replenish nutrients that are depleted. And if you have been on the pill definitely depletes a lot of the nutrients required to get pregnant. You want to look at your exercise. For conception, we do usually recommend taking it easy from the high intensity. If that's something that you love, of course, it's better to do what you love than to be on this like strict regimen. You want to get a stress management practice. So, stress at work, stress at home, things like that can delay ovulation and can contribute to kind of suppressing some of your hormones. I definitely recommend charting your cycles with fertility awareness if you can, so that you can start to see your patterns, see that if you're falling into the healthy menstrual cycle ranges, and then use the cycle as a fifth vital sign and diagnostic tool as you implement these more natural strategies and see if it improves.
Mhm.
And then after about a 6 month period, if you're still not seeing the cycle improve 100%, definitely you can work with functional medicine practitioner, get labs done, and kind of get more on the proactive side.
I always laugh because ultimately, at the end of the day, for things like this, even like to have an improved sex life, improved libido, there's no quick fix for it. It's doing all the things like you said. I'm sure that that's not always the answer that people want to hear. I think people want like something. They're like, "Oh, is that I just need to take one vitamin? That's all." And it's never that. It's the whole thing. It'll help with optimizing your cycle, and it'll also help with literally everything else, so it's worth the commitment.
These strategies actually can skyrocket the effectiveness of IVF, IUI, Clomid,
Mhm,
Letrozole. So, there's nothing wrong with still needing to go that route. But if you
mhm.
have such an inflamed environment that you're trying to do those interventions in, there's still a small percentage that those will take and actually turn into viable pregnancies. So we just want to create the most optimal percentage, highest percentage that things will take.
Oh, actually, one of the questions that I had was tips for anybody who is on hormonal birth control. and had gone off of it for a period of time and was having long cycles, having trouble getting pregnant. Do you have any suggestions for somebody dealing with something like that?
Basically, according to the latest research, it takes an average of 9 to 12 cycles for your ovarian parameters to normalize. So it's not abnormal to have this period of time where things just don't look great. And we would see that on the fertility awareness chart. We would see like low cervical mucus, maybe low basal body temperatures, long cycles, delayed ovulation. Once we've reached a period of time beyond that, we can't really blame the pill anymore. And what we do know from research is birth control does not treat or fix period problems, it reduces symptoms. So while you can feel better and you can have that monthly pill cycle, as soon as you get off of it, it's going to unmask what was really going on before. Someone who had maybe those abnormal cycles, they had really painful periods, maybe they were anemic as a teenager, they had really heavy and long periods, and they decided to go on birth control. What the body does is kind of pick right back up where it left off. So if it's been more than like 18 months, we would say potentially it's not the pill anymore. And we would want to definitely visit your doctor. You know, you want to get a pap, you want to get a pelvic ultrasound, you want to do like all those basic tests to make sure there's no infection, there's no fibroids, cysts, things that are like physically on and around the uterus. And then we also want to start looking at the root cause of the issues.
Right, right, that makes sense. And recently, I've seen a lot of my followers, like, really kind of express concern over hormonal birth control methods, which, I think everyone can make the choices that are best for them, but it is sort of, like, in a way, comforting to know that a lot of the things that you might be experiencing can be resolved in those, like, 8 to 10 periods, which is a long time, but at least there's sort of like a it's nice to know a time frame of like sort of the end of the tunnel in that way. Actually, speaking of periods, somebody had asked if your period is only a couple of days long, does that affect how fertile you are?
Yeah, so usually when we're talking about just one parameter of this cycle, it is the whole clinical picture that we would want to have to really give you the best answer. But we can go over the normal parameters of the cycle. And I would say this day and age, almost nobody fits in this normal parameter, which is just crazy. Bleeding days should be between 3 and 7 days. So there should be no spotting before your period and no spotting after your period ends. And there should be no mid-cycle spotting that we're talking about. So if you have a very light period, that could be indicative of low estrogen or thyroid problems or undernutrition.
Okay. So if you can have your period and not have ovulated, so it's just the shedding of the uteral lining. So would the period be lighter because you're not actually shedding like the
Yeah.
interesting.
So when we do the scientific charting method, we'll be able to pick that up if it's really a
Okay.
true period or if it's like spotting breakthrough bleeds is what we would call that.
Okay. Wow, there's so much that we just don't know. That's so wild. I had no idea that that could even happen. So when you're doing the charting, I'm sure there's a lot involved, but what's sort of like the overview of what charting is like and how a person can get into charting their ovulation and their periods and their cycles?
The fertility awareness based method charting is basically you actively participating in your cycle health and it's body literacy. And I think the world should be talking about this more. This is what we should be learning as teenagers, in
Mhm.
addition to how to wear a condom appropriately and safe sex and all of that stuff. This actually gives you the control over understanding when you're fertile, making your own decisions. Where am I at on the intention scale? Am I okay with the pregnancy? How okay with it? Where's my partner? You're making proactive plans here. We can use it for natural birth control. We can use it to optimize conception and just learning about your body. So your period is your fifth vital sign, just like heart rate, respiratory rate, blood pressure, oxygen. Your period is going to be reflective of other problems. If you test positive for an illness, you are going to see period changes. If you have an underactive thyroid, if you have a cold this month, if you have endometriosis, all of those things you're going to come out in the charting and in the cycle. So a healthy cycle is indicative of an overall healthy
Mm-hmm.
body. And the way that you get started with charting is that we really have to understand what cervical mucus is, what our basal body temperature is, and cervix position. So those are your three fertile signs that you want to be tracking and recording every day. The whole idea of sperm being able to be transported through the cervix up to the fallopian tubes and be there waiting for the egg to drop down is dependent on cervical mucus. And so that is a type of discharge that you're only going to see in this cycle as you're approaching ovulation. And it gets more and more and more like an egg white that stretches as you get
Oh.
closer and closer to ovulation. And so this is how actually a woman is only fertile technically for 6 days in the cycle. It's the day of ovulation, so that whole 24 hours,
Mm-hmm.
and then the 5 days before, because sperm can live up to 5 days. If you're confused by all this, the takeaway is if you see cervical mucus, it's a fertile day.
Okay. Okay.
And you're not going to see cervical mucus if you're on hormonal contraceptives, cancer medications, or you're pregnant. Let's say that you saw some mucus on Monday and you had unprotected sex, and then by Friday you ovulated. Friday, you could actually be pregnant from the sex that you had on Monday. And that is the entire basis and idea behind even looking at these fertile signs every day. So on Monday, if you were avoiding pregnancy, you would know that you were in your fertile window, and you would be abstaining, using condoms, using withdrawal, having a backup plan with plan B. Like you would be having those plans in place. And then on the flip side, if you're trying to conceive, you're actually trying to get as close to that egg white cervical mucus days as possible, because the last day that you have that clear, stretchy egg whitey mucus is 80% correlated with the day of ovulation.
Wow. I love the phrase body literacy. I think that's exactly what it is. That's exactly how it should be treated. And I agree, like these are things that you should learn in tandem with learning how to whatever, use a condom, different types of birth control methods, whatever STIs you're trying to avoid. It goes so hand in hand that it's really frustrating that we wouldn't learn this unless we were to seek it out.
We have other rules to ensure that you're following the method the most accurately. So don't hang up from this video and only use what I'm saying. It's really a little bit more complicated than that. So usually it equates to about a week of abstaining in a normal cycle. But the people that I usually work with don't have normal cycles.
Still 99.6 is pretty solid. For regular hormonal birth control, you have, a similar rate of effectiveness, but that's also if you're doing it, if you're taking it exactly the way that you should, which is at the same time, every single day, not missing a day. You're getting a similar level of effectiveness, but you're also doing this in sort of a more proactive way. I'm learning so much this is like, you're blowing my mind today, actually. One of the questions that I got was also if you could get pregnant from precum, which I remember this being like a big thing in the beginning of people's sexual experiences, if that was possible. It was like everyone was like freaking out about like, no, you can't, you definitely can't.
It depends. So this is a complicated answer.
Okay.
There's a small percentage of men that do have sperm in their precum, but you don't know who that is unless you get a semen analysis specifically of just the precum. So you're probably not doing that.
Yeah.
The only way that precum is considered fertile, it could get you pregnant, is if you had a withdrawal on a fertile day. You would kind of want to prepare all of that out. That way, when you ask yourself today, am I fertile? The answer is yes. Then we would have to know that withdrawal would be taking a risk.
And one of the other things that we talk about in like the sex ed space is using other course, which is everything that is not actual penetrative intercourse. So using toys, doing oral, doing really anything else that is not the actual penetrative sex. So if you're that person who is in your fertile window and you are like, I this is a hard pass, absolutely no for me, then maybe even something like an other course would be a way that you can work around that and still be able to have fun and engage, but not be um, risking that. Okay, so we've done a lot of the fertility awareness. Is there anything else you want to add to that conversation before we move into? We had a lot of questions about painful sex and um, anxiety around sex and how to like sort of relax the pelvic muscle. So
The only last thing to say about fertility is if you want to learn the charting, I definitely recommend working with a fertility awareness practitioner because there's more nuances to interpreting the chart than it seems like. I do work with people virtually all over. You can also find someone in your area, but it's really helpful to have a practitioner that you work with. So you can find me on Instagram. I'm pretty active there. It's Dr. Mel Thompson. So DrMelThompson. My website is louisianapelvichealth.com. And I do have virtual coaching options available anywhere in the country. So if you want to hop on a call and kind of work out what's the next best steps for you, you can always send me a message and we'll get you set up. If you are pregnant or thinking about becoming pregnant, I did create an awesome online course in conjunction with a certified nurse midwife. This is like the most awesome course for pregnancy, in my biased opinion. If if you're kind of a DIY and you just want to kind of do some of this stuff on your own, I call it the pelvic floor birth prep, and it's a 2-in-1 labor and pregnancy prep. So there's 10 modules, and we have a lot of videos, kind of like Netflix, for you to choose from. And you're going to hear from my midwife colleague, Tanya. She's going to show you all about how the baby moves through the pelvis. She's going to talk to you about how to combat, early first trimester nausea, things like that. And then we're going to talk to you about labor positions, how to push, how to breathe during pushing, how to prepare for postpartum. And then in my pelvic floor sections, I give you lots of exercises, strategies, and tips and tricks for you. So we'll link that below if you're interested.
Perfect. Awesome. And thank you so much for chatting with me today. And I appreciate all the time that you took to pull all this together. We've been sort of like working behind the scenes for a little bit, and I appreciate it so, so much. And hopefully we'll have some more questions and we'll get to do this again.
Yeah, I had so much fun. Thank you so much for having me.
Anytime, anytime.